Hi, I'm Dr. David Hill, and today we're going to be talking about how to put weight on an unborn child. We're really talking about fetal development here, and there are a lot of things that go into healthy fetal development. Hopefully, if you're pregnant, you've been working closely with your obstetrician or someone in that person's office, maybe a midwife, for example, to help you get through this pregnancy in as healthy a manner as possible. Really, the baby's health depends on your health. Now, there are some conditions that will limit a baby's weight gain, and if the person who's helping you with your pregnancy has been following the pregnancy along, hopefully you already know if one of those conditions is present. Probably the most common is maternal high blood pressure. Sometimes this presents as a condition we call preeclampsia. But if mom's high blood pressure is a problem, it can really limit the baby's growth by restricting blood flow to the uterus. Now, there are other conditions that may also affect the uterus and the placenta, and if you have one of those, hopefully you know it. If you smoke cigarettes, for gosh sake, stop, at least for the duration of your pregnancy. Cigarettes constrict blood vessels, and they do impact the growth of fetuses. They also can increase the risk that that fetus will, after birth, go on to have asthma or be lower birth weight. So you really want to get rid of the cigarettes if you at all possibly can. Now, you want to eat enough for yourself. You need a healthy diet. Your baby can't grow if you don't grow. In this day and age when we worry so much about maternal obesity and overweight, the average woman tends to gain a little bit more than her OB-GYN has advised her to do. But there are some women out there whose appetites aren't great, or who are really concerned with dieting, or just feel too busy to eat, and they may not be gaining enough weight. So do consult your obstetrician or your midwife and find out whether your weight gain is appropriate for your stage of pregnancy. Now, the vast majority of weight gain for babies or for fetuses occurs in the last 3 or 4 weeks of the pregnancy, from what we would consider gestational age 36 weeks to term, which is 40 weeks. So that's a real good time to make sure that you've got a good, healthy diet. It's a time you're probably starting to feel kind of draggy. You're carrying this baby around. It's getting hard. You're probably getting tired of the pregnancy, but you're almost to the goal. You've almost got a healthy term baby, and you want to make sure that you're following those good habits all the way out to the end. Talking about how to help a fetus gain weight in the womb, I'm Dr. David Hill.